GoodDoctors.Health. And I apologize. I'm getting on a bit late today. I was running a bit behind, but here we are ready to go. So, one of the big things that I wanted to talk about is what is happening in the world of AI and how it's impacting healthcare, and just basically the direction that AI or not even the direction, though it's pretty obvious that AI is taking over a lot of different things, but especially with regards to understanding how AI is going to be impacting your healthcare. So, first and foremost, I just want to state that we're not. It's not like while while we've been seeing you've been seeing your physicians, you've been seeing your doctors, and all of that. I'm going to tell you that, to be honest, you've been dealing with AI driven healthcare for a while, whether you realize it or not. At least technology driven healthcare. So for the most part, one of the big things that whenever all of the different offices and the different things that I've ran, I am amazed by how many times I would be going through my various offices and I would see the different doctors like standing out in the hallway, knowing that there's a patient like in the room, and I'm like, "Hey, what's going on?" They're like, "Oh," they're on their phone and they're like, "Oh, I'm looking up what's going on with this patient." They're googling what is happening, and they're trying to figure out, which is by all means a good thing. Back in the day, our doctors would go back and they go back in the back room where they had all these books, and then they would open the book to try to find out. So it's really, I'm not going to say this is anything new. This is not anything that we haven't been seeing for decades. Of course, doctors have been going and looking up some of these different things. The only issue is that the technology has been so enabling a lot of your practitioners and your doctors and your physicians, so they're almost not memorizing, they're not learning things the same way that they were 20, 30, 50 years ago. I mean, just like how many of us can't get from one place to the next without our GPS, even though we've been there 5 times. It's enabled us to stop memorizing and stop learning things in a new way. And that's one of the things that we're really seeing with technology. Now, the problem that I was really running into is especially looking at how EHR, electronic health records. So, and you pretty much will, if you're going to operate within the traditional healthcare system, now you pretty much will have to do EHR. That there's no way around it. But with so many systems, the EHR is almost guiding your doctors through the pathway of how they're going to work with you. So they have to go through these set of questions, and they have to click these various boxes in order to get to the point where they're able to do what they want to do with their patients. And it is really fascinating how having to check those boxes and having to read these various lines has changed the entire interaction with patients. So let me give you an example. One of the things that's in the most of our EHR systems, especially if you are in traditional healthcare and you're accepting insurance and all that, is you have to always ask about the pain scale. That's a question that is almost always on there. Well, when you're always focusing in on the pain, when you're always forcing people to zero in on the problems, it's amazing how much you're looking at the negative and not necessarily the positive. I know that seems very simple, and I get, okay, why are we splitting hairs here? But it's not. How many times do you walk into your doctor's office and pretty much the only thing they want to talk to you about is, here's what's wrong, here's what's wrong with you? How often do you get told what's right? How often do they go through, here's what's awesome about your numbers, here is where your numbers are saying you're crushing it? How often do you get told, like, look at all of these improvements? There's not a lot of encouragement anymore in healthcare, and there's a lot of reasons why that is. I mean, there's just not a lot of time, and I get that. The average primary care physician has 3 to 5 minutes per patient visit. That's what the time is coming out to be. Maybe up to 7 minutes in certain cases, but 3 to 5 minutes is starting to get to the average for a primary care visit. You don't have time for much else. I mean, you barely have time for hello, how are you, what's wrong. So We're seeing a lot of this, and there's a lot of documentation that has to get done in that 3 to 5 to 7 minutes. So that is dictating a lot of what you're seeing in healthcare. And unfortunately, when you only have when an individual has so little time, they're just going to have to kind of run through the system. They're not going to have a ton of available mental brain space to be creative, to really dive into ulterior solutions. I had an amazing case today. Absolutely fantastic in the way that her numbers in no way matched her symptomatology in the traditional sense. So when we were going through, we had to literally go line by line by line and pull apart every single diagnostic that we had on her to be able to figure out where her irritable bowel, and in this particular case, it was irritable bowel syndrome that we were trying to figure out. And but none of her numbers were showing a traditional irritable bowel. So, in going through it now, in her particular case, we ended up finding this very unique genetic condition that secondarily was creating issues in her bowel. But you know what? It took me almost 45 minutes of asking and going through all the different lines and understanding what she has done, what she hasn't done, in order to get to that point. AI is not going to do that in that way for a real for a really really long time. So one of the big things, and again, I'm a functional medicine physician, so that is I work completely now in the realm of holistic. We don't use any pharmaceutical, we don't use any medical management, and everything that we do is completely geared towards what is the body asking for with regards to diet, with regards to exercise, with regards to food, supplementation. What does the body need to actually target the root cause and reverse the disease process? That's the entire premise of functional medicine. So one of the things that I just want to make sure that so many people are aware of in the realm of healthcare is that AI is massively taking over a lot of what you consider traditional healthcare. And I get why they're doing this. And I understand it's for efficiency, they're trying to save costs, everybody's trying to reduce healthcare costs. Um, they're trying to create more standardization. They're trying to create more like they want when you see one person, it's the same as the next person, it's the next person. They don't want where people are always requesting that doctor and they don't want to see this doctor. And that's a lot of what these conglomerates are trying to do, and I understand. I understand when you go into a fast food restaurant, you want where people have a certain system that they come to expect. Okay, that's a part of franchising. Well, unfortunately, that's what our healthcare system is becoming is franchising. So now, with regards to, and again, the reason why I want people to understand, you know, AI and how that is, AI is only as good as the program it's only as good as what's been programmed with. Okay, it's only as good as what's been programmed with. So for so many of you who been following me, we've been working together for a really long time. You don't want the traditional solutions. You don't want more medications. You don't want those options, but these AI output, it's going to keep, it's only going to be, the AI is only going to output what's been programmed into it. And which system and who is programming the AI that is being used in a lot of these healthcare systems. It's something that I really want to make sure that today's modern patient understands what's happening here. And trust me, this is getting more and more and more. Even if you can't see it, even if you're talking to a live person, and I know it's kind of funny. Here I am I do everything virtual. But even whenever you're working with a live person, if they are using a very specific EHR, there's a lot of AI driven natures to what they're doing, and that can change the kind of results, the kind of healthcare, and the kind of recommendations that you are getting. According to all of the resources and all the conferences and all the symposiums I've been in, it's only become more. there is already they're talking about how there aren't enough physicians, there aren't enough practitioners, there aren't enough nurses. So they're already looking at it as how can we utilize more and more AI to offset the fact that we don't have enough in the workforce right now. They're already talking about where entire specialties they want to be mostly AI driven. They most of these specialties they want them to be going to the standardization. Then you only see a person if you don't fit into all of the other parameters. And to be honest, in some cases, I mean, and in some cases, honestly, simple infections and minor illnesses and minor issues, yeah, that may not be a big deal, and it may be good for our overall healthcare costs if you're able to get more access. But for so many of the people that I'm working with, especially as we're getting older and our health is much more complex, as we have had more history over the years, different things that have affected. I'm going to tell you that that is where the human component is so critical. And we are not to the point where I believe AI has transcended the ability to really, really help people. So, for those of you who you understand this and you're looking for better healthcare, please just like, subscribe, tune into all the different things that we are going to be getting into. I'm doing these really short lives here over the course of this month up to the new year, and then we'll be converting over to once a week, prolonged, very specific lives where we deep dive into some of the topics that my patient base and everybody is really looking for. So I really appreciate everybody chiming in. I hope you're having a wonderful holiday season. And if there's anything I can do, just reach out to us. Thank you so much.